Good afternoon. Welcome back to Track 1, Capacity Building. My name is Robert Austrian. I'll be your room host for the last two breakouts for this track. As a reminder, this session is also being live streamed through the platform Q, and we want to welcome our remote attendees to the session. The first session this afternoon is on effectively utilizing social media to engage your rare disease community. We're in the age of social media, as you can tell by the summit's social wall in the main ballroom. This session is going to be presented by Melissa Hogan, the founder and president of Saving Case and Friends, Inc., and Stephanie Fischer, patient advocate and the senior director for patient engagement and communications at Every Life Foundation for Rare Diseases. Ladies.
Thank you all for coming, and I do have to clarify, when I tweeted Melissa would give each of you $20 for joining us, I was just kidding. Oh, sorry. I did just want to take a minute. You heard from my colleague Max this morning, but I want to make sure that I started with an introduction to the Every Life Foundation in case you're not familiar with it. Our focus is on accelerating innovation for rare disease treatments through science-driven public policy. We have an annual scientific workshop which was held earlier this year, and the topic was expanded access. We also have a community congress that brings together industry and patient advocacy organizations to work together on public policy, as well as patient programs such as our Rare Artists program, which you can enter now through December, and also our Rare Giving program that provides travel stipends to our Rare Disease Week on Capitol Hill, and also FDA and NIH meetings, as well as sponsorship of patient and physician events. And then some of you may be familiar with our program called Rare Disease Legislative Advocates, and that's a clearinghouse and resource for any organization involved in rare diseases.
Hi, and I'm Melissa Hogan. I like to say that I am a reformed lawyer, and now I'm a rare disease advocate. My son was diagnosed with Hunter syndrome, which is mucopolysaccharidosis 2, about 7 years ago. And so now I run a nonprofit foundation and do advocacy work with Global Genes and others, and serve on the advisory board for the Mayo Clinic Social Media Health Network, where we do a lot of social media stuff related to healthcare and rare diseases and things like that. So let's talk about social media. So first, can I do quick shows of hands? Who has a website for their organization? Should be everybody. Who has a blog? Okay. Who's on Facebook? Okay. Who's on Twitter? Who's on Instagram? Who's on LinkedIn? Who's on Reddit? Who's on Snapchat? Okay. YouTube? Okay. All right. We just wanted to get a good sense. So one of the important things, so we're going to go through our slides, and then we're going to hopefully have time for questions at the end. So one of the important things to think about when you're doing social media is what is the point? Who is your audience? So that audience is going to be different by disease. It's going to be different by demographic. It's going to be different by country. So you need to know your audience and who you're trying to connect with. So your audience may not be on social media. So they may be in doctors' offices, hospitals, schools, and it may not be very effective for you to put tons of time and energy into social media. But most people are. So if they're on social media, where are they? You don't want to put all your time and energy into Facebook if your demographic is 18 and under. So you need to think about where your audience is, and that can help you determine where you should spend your time on social media. So the second question is, why are the people in your community on social media? And then what do you want to get out of social media? So there's lots of different ways you can participate in social media. For most of us, I would say, for lots of people in patient advocacy and with nonprofit organizations, we want to be at the top. We want to be an influencer. We want to be able to raise money on social media. We want to be able to advance the objectives of our organizations. We want to be able to help recruit people to clinical trials, to raise awareness. But at the beginning, maybe you just start out as a consumer, and maybe your audience are mostly consumers. So you really need to think about this. Think about where your audience is and why they are where they are and why you want to be in certain locations on social media, because that will inform how you spend your time and what you learn. So as you can see from the different types of social media, some of them are more amenable to different activities than others. Having a blog can help you gain a lot more influence. Let me click through these faster here. So some people get very intimidated by learning social media. So 4 years ago, I was up here at the Global Genes stage giving a talk about social media, and I would say the numbers of people raising hands for a lot of these mediums was a lot different than it was today. So people had a lot more fear about learning social media and making mistakes, and well, I don't want to get on Twitter because I'm going to screw up or I'm going to tweet the wrong thing. And so when I talked about it then, the point was it's very forgiving. You're not a Fortune 500 company who, if you go on social media and make a mistake, it's going to be headline news. So just realize that it's very forgiving of your mistakes. And there are people, especially in the rare disease community, who want to help you learn social media and have been doing this, who are 3 years down the road from where you are. And they're more than willing to help you. And I know Stephanie and I are. And if you get on some of these mediums today, tweet us or tag us, and we'll follow you, and it all becomes a big rare disease party.
And it's a beauty and the challenge of Twitter is, back to Melissa's point about being very forgiving. Depending on how many people you follow, you'll see I follow about 4,000 people, and so my feed is refreshed every 2 seconds. And so if you say something stupid, I'm not saying you take time when you do a tweet, because once it's out there, you can delete it, but someone might have a screenshot. But there's so much content that if you misspell a word, don't sweat it. Again, hopefully people will see it and retweet it. But if not, again, so much content that it's going to kind of flash by the screen.
Yeah. And a lot of these, we call them, especially Twitter, it's like a cocktail party. You don't have to be on there 24/7. And I think sometimes we feel like we've got to be on there, either whether it's personally or even for our foundations, because we need to see what's going on. But you don't. You can dip in and dip out. You can schedule posts on a lot of the formats, like on Facebook pages, you can schedule posts. On Twitter, you can schedule things, and there's different programs you can use to do that, so you don't have to be on there. And with social media, the best thing to do is learn at your own pace. So when I talked about identifying your audience and why you want to be on there, so you want to identify the medium that's most important to your community and will help you the best in your organization, and you start there. And then maybe you move on to the next one. You don't all of a sudden have to go on and you go from 0 to 60 and you're on every social media channel. Now, as a caveat on the side, you might want to reserve, if you have a particular name or a unique name, you might want to reserve those on the social media channels. But that doesn't mean you automatically have to start tweeting and posting and putting up YouTube videos and things like that. So if you don't have a strategy, I didn't start with a strategy. I just got on there and started doing things. You don't have to right away. In a perfect world, would you sit down and say, I'm going to analyze everything and I'm going to have a home base and I'm going to strategize and I'm going to have a content calendar? Absolutely. But I don't think any of us are working on the bandwidth where that's capable or that's possible all the time. So you don't have to start with a strategy. If you're a type A personality and that makes you feel better, maybe you want to start there. But, dip your toe in a little bit. So we're going to go through some of the platforms, a little more specific and some a little more general, just so we can have a basis from which to talk. So obviously, social media, there's so many. And, some are more important than others, like I said, by demographics. So you pick your platform you want to start with, or the next one you want to work on. You want to pick your purpose on that platform. Is your purpose to learn? Is it to connect with people in your community? Is it to connect with other rare disease organizations? Is it to raise awareness? And you may have multiple purposes for any particular platform, but this is just to challenge you to think about that. Think, what is my purpose on here? Is it to educate? Is it to give a call to action? That is something that our DLA does very well, issues a call to action like the Cures Now call to action we did this morning. So figure out what your purpose is on that platform. And then when you're on that platform, who are your partners? Is it your community? Is it research organizations? On Twitter, are you going to seek out all the other rare disease organizations, the governmental research organization, the pharma companies that are in your space? So you want to pick those partners intentionally because you want to see what they're saying, and then you want them to see what you're saying.
And again, this can be over time. This isn't, you don't have to do it, the day you sign up for Twitter does not mean that's the day that you do all of this. And when I spoke 2 years ago to a much smaller room about social media, it was, we realize you have a lot of challenges on your time. You might be a patient, you might be a caregiver, you may have a full-time job, you may have a family. Literally 15 minutes a day can make a difference if you're smart about how you use that time.
So just as an example, in looking at some of the partners that we started with, we started in our disease space in Hunter syndrome and in the broader mucopolysaccharidosis community. And then we looked broader at the rare disease community who was in that space. Medical research. So there's NCATs, there's the pharma industry and those companies that affect our space. There's conferences that normally exist for rare disease. Then there's patient advocacy organizations or people that are very involved in patient advocacy. In our case, because our disease involves cognitive impairment, there's special needs advocates that are also on social media. And then there's assistive technology. So this was the example of kind of my social media world and the wheel that I started from and went around. So if that's helpful as a visual to you to start thinking about who those partners might be in your space. So I'm going to turn it over to Stephanie for a little bit, and we're going to talk specifically about one platform, Twitter, as an example or an illustration for social media use.
And that is definitely a subjective statement that it's the best social tool. I find it the best social tool. It's more straightforward than Facebook, which seems to change the algorithm of how posts appear on your page and whether you have to pay for that. Twitter's pretty straightforward. And I've made friends through Twitter. I once arranged a tweet up at a bio convention specifically to meet Ethan Perlstein. I've connected with patients. I've connected with pharmaceutical companies. It's really powerful. And again, it's straightforward, which is a benefit. So again, I realize some of you are much more advanced because I follow many of you on Twitter already. But for the new folks, your handle is your name. How people will know you. Try not to, I like the ones that are straightforward and not missing all the vowels, just because you want, if people are searching for you, it's easier if your handle is straightforward. They're more likely to find it quickly. If you're a speaker and they're trying to find you on Twitter, just make it as easy as possible.
And just an aside about Twitter names, I started originally as Saving Case, and that's how people knew me, and they didn't even know my name. And I would be at conferences. So you really need to put some thought into, and so now Saving Case is our foundation Twitter handle, and then I have a personal Twitter handle, Melissa J. Hogan. So you need to really think about that and how it's going to further what you're trying to do the best, and maybe it's having to as well.
And this goes a little bit more into strategy than basics, but when you use someone's Twitter handle in your tweet, they get a notification. So they will get an email, and if they're on an iPad, an iPhone, it'll pop up to let them know. So the example was Melissa's son, Case, in a photo for Cures Now. She was smart and tagged both of her senators. So both of the senators' offices got a notification that they were mentioned in a tweet about Cures Now, and that's part of the reason it's so important and easy to use social media to make a difference in public policy. So for your bio, mine has rare disease in it, because again, and we'll get into this in a minute, the purpose of hashtag, but it has to be short because it's Twitter. So make it as meaningful as possible. Make sure you have a link to make it easy for people to have more information, and then use a hashtag or two about what's most important about your organization, what kind of content you have, what your purpose is. And you may have heard in some of the breakout sessions the importance of kind of your elevator speech, and this is great because you are limited in characters for your bio. This is basically should be your elevator speech. When someone says, well, who are you, what do you do, what should be boiled down in your Twitter bio. So the fun part, hashtags. So they've been compared to the name of a file in your filing cabinet. So I regularly search for rare disease, Cures Now, clinical trials. And so that's a great way. By using them, more people will see your content. So when you tweet something, generally only your followers will see it. So if you have 6 followers, then 6 people will see it. If you have 4,000 followers, 4,000 people will see it. But by using hashtags, anyone who's searching for that hashtag, that content, they will see your content. So your message gets more eyes on it. The people who I see for the topics that I follow and search for, if I'll see their tweet, it looks good, I'm going to follow them because I want to see what else they have to say moving forward on the topics that are important for me. If you're having, that's the next slide, sorry. So for broad is rare disease clinical trials, more specifically for your rare disease, if there's not already a hashtag, keep in mind that the character limit of 140, so I have antiphospholipid antibody syndrome. I'm not making that a hashtag because it would leave me no room to put anything else in the tweet. So you do have to be as brief as possible, and also that applies to conferences as well. If your conference is a 10-word name, you probably want to do something a little shorter. So for Rare Disease Week on Capitol Hill, our hashtag is RareDC 2016 for this year. Because anymore, again, you're cutting down on what the people who tweet, the kind of content they can include. They may want to include a policymaker or a speaker in that tweet, and so you need to leave them room to include the content. So one of the ways, one of the things that I find important is it's great when we talk to each other and we learn to each other, but we're not going to really affect change unless we can engage people outside of only those people affected by rare disease. Even though we're 1 out of 10, if we can have 3 or 4 out of 10 talking about it, then we have a greater chance of making an impact. So I like to try to inject my point of view as a rare disease patient and an advocate into broader conversations. So there was a publication that wanted to know what's on your science bucket list. And so that's why we tweeted, we used that hashtag so that that publication, anyone else who was kind of playing along in this game is going to see our points as well.
And just a note too about hashtags, if you go on Twitter, they always have trending hashtags. And so sometimes if you want to inject your ideas or your agenda into that, you might see articles about different hashtags that people are using. You might inject and use a hashtag. So I'm sure that day, Sci Bucket List was being tweeted about by friends of ours who are in the science community. And so then that's how you know about some of those and put them in there. So presidential debates, there are going to be millions of people on Twitter. These are expected to be among the most highly watched debates in the history of presidential elections and televised debates. So maybe we all follow and start, do they make a point about healthcare that would particularly impact the rare disease community? I'm not sure what the hashtag is for Monday, but if I'm live tweeting, you can make sure that I'm going to use it because then media outlets are going to see it. Maybe people sometimes I miss an event, and I will go back and look at the hashtag. And even when I'm at an event, we can't be in all the sessions. I go back and read. Sometimes you can weave a story together by what people are tweeting. So find those popular hashtags and put your point of view as a rare disease advocate. Interject in the conversation. As I mentioned before, the number of people who automatically see your content is your number of followers. So don't get discouraged and stop tweeting when you have only 6 followers. You have to build that audience by having relevant, informative content. Retweeting is important, but you're not sharing your unique view. All of you wouldn't be here unless you had a unique point of view. You have something to say, and there are people outside of this room who are going to find value in that. So share your thoughts. If there's public policy at a state or federal level, if in your community there are needs that aren't being met, even if there's not public policy, start talking about that. Do you not get enough support as a caregiver? Should NIH be spending more money on this disease or that disease? What do you think needs to be done that would make your life as a patient or a caregiver or a sibling easier? Share your point of view because there are other people who will agree with you. And also, just like in person, as we all know, I think if you have a foundation or if you're in a job or anything you're doing, part of that is establishing credibility. So there's establishing credibility in person, which is having meetings of your organization, going to conferences, coming here, meeting other people, and you become known as a person who has valid information or a has the right facts, has a good opinion, has the right connections. It's the same thing online. So if you start with 6 followers and people see that you are tweeting great information or facts or connections to articles that they find interesting, you'll start to be able to build that online social media credibility. And it may take years, but you want the right people seeing your stuff, and you want to be connected to the right people too.
And the easiest way to do it pretty quickly, first of all, you're here. So go on Twitter and search for the conference hashtag 2016 GG Summit. I've pretty much been doing that all conference. In between, on a break when someone's talking and maybe the science is over my head, I'll go on and see what other people are saying, and I'm going to follow them. Outside of conferences, Global Genes, the Every Life Foundation, Rare Disease Legislative Advocates, NORD, any of the umbrella rare disease organizations are a great place to start. Take a look at who they follow, because chances are they find their information relevant, credible, and important. So that's a really easy way. And again, when we talk about, I only have 15 minutes a day on this, I do it when I'm watching TV it's easier than getting up to grab the remote to fast forward through the commercials. It doesn't take a lot of concentration. And again, people are more likely to follow you if you've already followed them, because that's a way of getting on their radar.
I'm tweeting a picture of the audience.
And as we mentioned, so more followers means every time you tweet, more people have the opportunity to see it. I guarantee you not every follower is standing at a computer or a portable device staring at your Twitter feed, but the number of people who follow you are the people who have the opportunity to see your tweets because they show up in their feed. And the more people who follow you, if your organization has an action alert or an event, or even you're trying to raise awareness, so you're asking people to retweet, the larger your audience is, it's more people who will potentially take action because it's more people you have to ask them to do it. This is one of our most recent examples. Frank Pallone, Congressman Frank Pallone he's spoken in favor of the Open Act, and he's a key position in Congress, and we want to make sure that we remind him how grateful the rare disease community is to shore up his support. So we asked it for retweets. We're actually up to 51 now. So again, the more people who we have who follow us, it's more people who are going to see that and then can take action. We covered a little bit of this earlier. You're more likely to gain and keep followers by being a reliable resource. When I see someone who's tweeted, say, with this hashtag, before I follow them, I may take a look at their tweets, and if most of their tweets are pictures of their lunch, maybe I don't. So be thoughtful about it. Don't set the goal of I'm going to tweet 5 times a day if you don't have something to say 5 times a day. And as we talked about, if you have 15 minutes a day, maybe 2 times a week you're adding followers. It really doesn't. Be thoughtful about what you share. You all look like people who have 5 good things to say in a week, so maybe your initial goal is I'm going to find 5 interesting things, or I'm going to share 5 facts about my disease every week. So, you do that over 3 days, you share 5 facts. That's fine. Do that rather than, sometimes I'll stop following people if they're, it's great if there's an action alert and you want to tweet at each member of Congress. If you do that every day, you're now clogging my Twitter feed, so I may unfollow you, or there's a way you can mute people so their tweets don't show up in their feed. So just be careful about tweeting just for the sake of tweeting if you don't have something to say.
Well, and that's another reason why you want to consider at the very beginning your accounts, and why I ended up splitting my personal account from our foundation was I wanted to tweet pictures of my lunch. Yeah. And I write a personal blog as well as a blog for our foundation. And I knew that I didn't want to assume that people wanted to read about things that were wholly unrelated to rare disease, even though I know they all love me. But so then they can follow me personally, or they can follow our foundation, which is pretty much all about rare disease.
And I have 3 personal Twitter handles, but one's just for entering contests, because people in the rare disease world don't know that I want to win like a Kate Spade handbag. And I do want to mention the last one. One of the great things about Twitter is the opportunity to engage people. Author Jennifer Weiner, she responded to a tweet once. So you can engage, and in rare disease, this is a great opportunity to engage reporters. Rare diseases may not be on the radar, or you might have like an Amy Marcus at the Wall Street Journal who does great work. I want to thank her when she does a great article. I'm going to promote her article. I'm going to tag her in it to make sure she gets credit. and I may just tweet to her, hey, thanks. You can tell you to put a lot of time in that article. Thank you for talking to rare disease families and making sure that our voices are heard.
You would be surprised with who will respond to you on Twitter. That if you went up to them or you send them an email and they won't respond, but they'll talk back to you on Twitter.
I have a non-sexual crush on Francis Collins, and he's responded to a tweet on a tweet chat. So again, it's a great chance for people who you may not see at the grocery store, but it's a great way to get on their radar. Again, thank them, be a little provocative in a polite way. Again, I'm not going to pick fights on Twitter. It just, if you disagree with someone in a tweet chat, maybe send a direct message and ask if they have a source or. But it's just a great opportunity to engage with people who you may not meet on a daily basis. And this is just critical for our foundation and for rare disease legislative advocates. Twitter is it's so easy to engage policymakers. We talked a little bit, we had legislative conferences in 3 cities this summer to prepare advocates to meet with their members of Congress over the summer recess. It's kind of like if you have a conversation with your member of Congress, that's great. And the people who know about it are in the room. But if you post it on Facebook, if you tweet a picture, the number of people who know about that meeting and that you've asked the member of Congress to do something just grows exponentially. So for Rare Disease Week on Capitol Hill, we ask everyone, take a picture with the member of Congress, with the staff. Some offices have rules that staff can't do that, which I don't understand. It's in the office, so should be a sanctioned meeting and everyone will be fully clothed. But if, take a picture in front of a flag, the sign to the office if you have to. Again, definitely be respectful on social media with your members of Congress. Tweet a picture, thank them. If they've joined the Rare Disease Caucus, thank them. If you went to a town hall and they answered a question about rare disease, again, thank them for their time, thank them for their interest. It's a way to stay on their radar. And we've used Energy and Commerce as the committee that unanimously passed the 21st Century Cures Act. They have been brilliant with using social media to keep Cures Now on the radar of policymakers and nationally. Still hasn't gotten the Senate to act, but it's kept the discussion going. It's kept advocates engaged, which is pretty impressive if you think about all the public policy issues. And this bill passed the House last July. So they've kept advocates engaged, partly through social media. Candace is a rare disease advocate from Florida who's been awesome about using social media. So that's one. Again, Cures Now, use the right rare disease hashtag. Stephanie is a very active advocate for MPS. They used it for their fly-in. Again, tag the people in your group, tag the member of Congress or the staffer who met with you and thank them for their time. Do you want to, since you have a blog, I don't know if you want to take this one?
Yeah. This is another way too. Like we said, you can link to things on Twitter, and most people do. It's not just, oh, here's my opinion, I'm going to put it in a tweet. So on the right, you'll see a blog post that I wrote about my son called The $6 Million Son, and it was about the cost and pricing of rare disease drugs. And what patients think about that. So you can post your blog posts and then tag. You can see I tagged people I thought that might be interested in it, not only for the topic, but because they might want to retweet it. But you can also send it to journalists, other people that you find that would be interested in that story. And then, like I said, on the first one there, you see that they tagged the Washington Post. So if you want to give input into articles that they've done or research, or especially like topics that they write on frequently, you can tag them in that, or articles, you can promote their articles, and then they'll see that too.
Well, and in that case, it's more, when I have my point of view, I assume everyone thinks is incredibly important, but even better if I can find someone who's really credible who said it. And again, want to demonstrate it's not just me, there's a lot more people who were interested. So I'm going to, in this case, the Washington Post had a great article, so we wanted to point to that and say, look, there's a groundswell that NIH, that people think NIH is important and needs more funding. So we just got the heads up that we have to go a little bit more quickly. Global Genius does a great job of using Twitter. We can't be at all the sessions. Using the hashtag lets you find relevant content more easily. If you're hosting an event, and I'm going to do this better. I didn't do it as well as I should have this year for Rare Disease Week on Capitol Hill. People who are going can find each other, make plans to meet up in advance. It's just a great way to build enthusiasm for an event that's coming up. It's free to register the conference hashtag on something called the Simpler Healthcare Hashtag Project, and there's going to be a link at the end. Again, I'm going to go through these pretty quickly. So those are just examples. We are happy to share this slide deck. Just tweet at Melissa or I. Our handles are on this sign, and we'll go over them at the end. Really quickly, again, tweet chats are a great way to find other people with similar interests and a great way for us as rare disease advocates to interject our thoughts on broader conversations. The Healthcare Leader tweet chat is one that when I have time I like to participate in. It's doctors, hospital administrators, and some patients, but I want to make sure the rare disease patient perspective is represented in those broader conversations about, how can hospitals better incorporate patient feedback? Like, we're supposed to be restful, it's too loud, it's too bright. Just little things, a way of we can incorporate our view. It's a good way to find thought leaders in related areas, again, like hospitals or doctors. And Simpler, which I mentioned before, has a list of tweet chats for the week. And again, we'll have a link to that in the resources. You're more likely to spur action if you ask your followers to do something. And Pharma, the trade association, has a brilliant person in charge of social media, and he has data that if you spell out retweet rather than write RT, people are more likely to do that. And the reason you want people to retweet is, again, if you've got 6 followers, 6 people see it. But if all 6 of them retweet it, and they each have 10 people, like every time someone retweets, they exponentially increase the number of people who see your message.
Okay, so we spent a lot of time on Twitter, and that is because, one, we found it to be one of the most effective tools for rare disease, and 2, we found it to be vastly underutilized in the rare disease community. Everybody knows what Facebook is, so I don't know that I need to really give a lot of information here about how to do things. But there's your personal profiles, there's pages that you can have for your foundation. There's Facebook Live, which is a new tool that live streaming that people are fooling around with a little bit. And then there's Facebook ads, and that's where you pay for your information to come to people more readily.
And if you have any questions on Facebook Live, Kristen Smedley with Curing Retinal Blindness is a pro at it, so definitely seek her out. She's here and she's on Twitter.
So just real quick, obviously Instagram lends itself to more visual images. They now have different sizes, and you can do videos up to 60 seconds now on Instagram. But we create images that are compelling, and you put them on Instagram. So again, there might be a different audience for Instagram than there is for Facebook or Twitter. And here's just some information. Like I said, we can send the deck to you if you're interested. Snapchat. So I had to do a little research because I'm on Snapchat, but I confess I don't use it that much.
And I thought it was just for teenagers sexting, so I'm not even on it.
But if you are on Snapchat, there is a geolocation filter for this conference. And I didn't put it up there because I didn't know about it when I did this slide deck. But yes, if you swipe left after you've taken your picture, you can put you have to be in the hotel, I think. So there's a geolocation filter that's Care About Rare for the Rare Disease Conference. The user interface, let me just be really honest, is really terrible on Snapchat. So it is hard to learn. So find someone that's under 16. And they can probably help you, but it's got fun stuff on it too. So you can make things public, and they're on there for up to 24 hours for people to watch as over and over, or you can send them as messages to people.
And just be really careful that when if you're trying to send a private mention, make sure you check the setting very, very carefully.
Yeah. So then live streaming. This is, we don't know really where the live streaming is all going to go because apps have kind of churned in this space really quickly over the last couple years. So right now, this is what pretty much exists. Facebook Live, Periscope, YouNow, which is for really young kids, I've since found out, and then YouTube Live. So, but here's the things that are really important. A regular schedule, notifying people when you're going to do a live event. It's great for interviews or events. And people can interact with you and you can respond on the live feed. So obviously, we did not go over a ton ton of different platforms that people are using. We tried to hit what we thought would be most effective and what people needed to know about things that were underutilized. But I think we all are fairly familiar with Pinterest. It's a visual linking platform. YouTube, videos. LinkedIn is the more professional, and that's where I connect a lot with pharma people. And because it's more, and it shows your credibility. You can establish your credibility on LinkedIn in a variety of ways and publishing things on there. Reddit, I've been on Reddit for a while, but it's again a steep learning curve and to establish credibility on Reddit. So find somebody who's really good on it and have them help you. Google Plus, again, similar in Facebook in some ways, and then Vine is a churning kind of video app, if you don't know that. So one of the things that we thought maybe we should have started with at the beginning was blogging, because people a lot of times are very intimidated by blogging, and a blog is just a great way to have a home base where you start from, and then all your social media kind of streams out from that. If you're not a writer, I understand that it can be intimidating. I am a writer, and I love it. And I actually learned WordPress, which is the most popular blogging platform, from a book called WordPress for Dummies. So that was 6 years ago when I started my blog, and it grew to be read in over 100 countries. And that's now our foundation's blog. And I have my personal blog as well. So you can learn it. You can learn it from WordPress for Dummies, or you can use the platforms that are really more plug and play. WordPress.com is less difficult to learn than WordPress.org, which is where you have your own hosting. But then there's Blogger and Wix and some other things that are a little easier to learn. And
I just want to add, if you're not a writer, you can still use a blog and be effective. You can, if there's a news article you really like, if there's someone else's blog post you really like, do a 3 or 4 sentence intro and say why it's important, what you agree with, how it's relevant to your community. And then there's your blog post for the day. So you don't have to write a short story or poetry. It's just 3 or 4 sentences of why you want to share something.
So we had a couple quick examples. I know we're almost out of time, or are out of time. But this is an example of a campaign that we launched last year called Project Alive. And it was a cross-social media campaign. And because we're an all-volunteer organization, I can't confess that it had some gorgeous planned-out strategy. But we did the best we could, and it was YouTube-based, video-based. We had a website. We pushed images and short video clips out on Instagram. We had a lot of celebrity support. Jared Leto did a video for us. Pete Carroll, the head coach of the Seattle Seahawks. Dave Ramsey. So we had a lot of great content.
You forgot me.
Oh yeah. But this, we raised a good bit of money for this. One of the videos got picked up on Love What Matters, and I think ended up with 170,000 views, which was great. So this is just an example of something. You can see a lot of it's very visual based and powerful in that way. So that was just an example of a cross social media campaign. And if you want to, there's some flyers down here if you want to tag it in your memory to look at it.
And I have 2 screens, so I'm going to go through ours pretty quickly. The EveryLife Foundation, my colleague Max has been leading a push on Cures Now. Again, the Senate has very limited time to act. Thank you for those of you who joined us this morning to do your sign and to tweet to your senators. If you slept in or were lucky enough to be at the beach this morning, we should have the photo frame in the. My colleague Max is holding up the photo frame.
Max, right there.
We'd be happy to do your picture. I'm happy to stay afterwards if you have a Twitter account and you're not sure how to tweet that out. But there are now hundreds of tweets about this. The Energy and Commerce Committee has been promoting our efforts because they're grateful. And again, this helps keep the momentum that will hopefully spur the Senate to act. Otherwise, the legislation has to be introduced next year and start the process all over. I want to actually highlight, there are 2 teenagers, Shira Strongen and Emily Mueller, who have been very active for rare disease policy, and they had their own push over the August break. Their efforts were also included in a press release from the Energy and Commerce Committee, and they were able to engage young adults who I hadn't seen engaged in public policy to talk about why Cures Now is important to them. The young lady in the middle is in a prom dress and had to stop and give herself, I can't read the writing, whether it's nutritional supplement or medication, but it's two teenagers who made a difference. There was a federal congressional committee taking note because they were through just social media, and they didn't even use paid ads on Facebook, just by engaging their Facebook and Twitter followers, and they might have been on Instagram too, but just by using social media, they engaged hundreds of young adults who don't normally pay attention to public policy, and were able to explain to them through a few blog posts and social media posts why public policy is important and the kind of difference that policy, specifically 21st Century Cures, could make to as far as improving and even saving their lives. So they couldn't be here because they had another meeting, but I just wanted to give them a shout out because they're a great example of how social media can make a difference in public policy. These are some of the resources. I realize the print is very small. We are happy to share the slide decks. Global Genes has 2 toolkits on rare disease they should be on tables. For those of you who are live streaming, if you Google Global Genes toolkits, you could find both of these. They're free resources. One is how to promote your rare disease story through social media. The second is using storytelling to raise awareness for your rare disease. They're great resources and they're free. And then we have a few other simpler healthcare hashtag project. Again, they list tweet chats and conferences. If you're going to have a hashtag for an upcoming conference, definitely register it. It's free to use, free to register. I love Storify, another free service. You don't even have to be at the conference. You can take a conference hashtag and pull tweets that you think help tell the story, or even make the points that you want to make, and you can easily tag the people and then release the Storify, and they make it easy to even notify people who are in the Storify in your version of the story. So I find that really helpful for not only conferences, it all can be tweet chats, or even just pick a topic. You could do one on rare disease public policy. You could do one on medical foods, any topic that you're interested in. You should really have a hashtag that makes it a lot easier. Otherwise, you have to do it manually.
I'm sure there will be several Storifys on this conference because they'll pull this hashtag. And also, I should say, you can, if you want to start looking for people to follow, you can find the top social media influencers in rare disease that was put out several years ago and has been updated. I think Stephanie and I are both in that, as well as a bunch of people who are here at the conference. So that's a great place to start. I would be remiss if I did not point you to the Mayo Clinic Social Media Health Network. They have an entire curriculum on social media that is really amazing. I pushed, and they have an advocate membership that's $45. So that's really amazing, because healthcare institutions join this for lots more than that. But it's a great way to connect with other people who are at the top level in social media all across the healthcare continuum.
And our room host is getting out the big hook. So I just want to make sure that you know how to reach us. We're happy to share the slides. We're happy to answer questions. We'll stay afterwards. You can reach me at Rare POV for Rare Point of View. You can reach Melissa at Saving Case. And we really appreciate, we know we are in competition on some really hot topics. So thank you all for taking time to join us and not learning about other issues or being at the pool or the beach. So thank you.
Thank you.
We have time for a couple of questions. 1 or 2 questions we have time for.
Robert's going to bring you a mic.
Hi, this isn't a question but a comment. So I work for PRA Health Sciences, and as another incentive to get on social media, I actually present social listening and social intelligence to clinical research teams. My group is responsible for pulling and doing searches on all the great things that you guys are sharing on social media. So it becomes a really compelling story when we're sitting with clinical research teams and we're able to actually share the patient voice in a lot of the discussions that we're having as it relates to research. So it's really impactful, and no other CROs are currently doing it. So if you have any other questions on that, I'd be happy to answer it, but very powerful for us when we're having discussions around research.
She makes a very good point that I did not mention, and that is one of the reasons why I got very heavily invested in blogging was that my son entered a clinical trial 6 years ago, and I started blogging about my son's clinical trial. But I was a strategy consultant before his diagnosis as well, and it was very strategic because I was putting information in there that I wanted the pharma company to know. And if I wanted to bitch about something and I wanted them to know about it, I also put it in there. You know, these things are keeping patients from enrolling in this trial. Let me tell you about it, because I knew they were going to see it. If I wanted policy issues heard about, I'd put it in the blog. So people are listening and looking for what you have to say, especially if you're talking about a specific rare disease. So know that and own that.
My name is Dr. Bill Loudon.
I can't hear you.
I'm Dr. Bill Loudon. I'm a pediatric section chief neurosurgery at Children's Hospital. First of all, I need you all to recognize that the future of your children lies in your hands. You are the advocates. My next 10 years, the last 10 years of my career is going to be spent on trying to focus in on harvesting the potential that sits in this room to help me cure your kids, okay? The question I'm going to ask you is that in the 10 years from now, where do we want to be? What you're describing is great in the here and now, but to be true advocates, you guys have to be able to compile much larger data sets than what you're talking about now. There's going to be a need for all of you to have your kids have their genomic sequences in a cloud and be analyzed and reanalyzed over and over and over again, plus all the other criteria. Then you're going to need to be able to put these all into groups, and you're going to need to share and have these groups evaluated for common pathways. More and more and more. What I'm not a user. I don't have time, I'm afraid. But what I am afraid I'm seeing is the divergence of all these social media techniques. What we really need to be doing is the opposite. We need to be coming together so that you guys have depth and breadth of the material and the data and the clinical information, and a mechanism by which you can use that to advocate for yourselves as a group and as an individual. And I don't see that.
And that's a very valid point, because then that's part of my point to say you don't need to be across every social media channel. And the society has a way of wheedling out the things that aren't working. As you can see, a lot of the live streaming has gone to pot. And so some of these apps, you know, they come and they go. And as we can see from a lot of the technology, they're finding better ways to integrate the social into the actual data gathering. And so really staying up to date as to what's out there. If you're not a producer of that kind of technology, being familiar with what's out there and having input into the conversations about what this is going to look like. There's another conference that's often around this time called Stanford MedX that was last weekend. And they have a great cutting edge thought onto a lot of these issues, specifically things like technology and where that's going to go. So I'm always staying up to date about where this is all going, because I think you're right. The social will input and have a large impact on the data and where we go from here. Okay,
We have
Robert?
one final question here.
Hold on. The terminology that we're using in the science field is we're looking at a culture where things are siloed, where data sets are siloed and we compete with each other. So you talk about Stanford, you talk about Mayo, you talk about Boston, Toronto Sick Kids. All these places are individual institutions which are siloed and restrictive. Okay? This is another culture change that has to change. For us to cure, especially in the realm of rare diseases, we have to knock down the silos, we have to join forces.
But social media can help with that, right? I mean, they're using social media for clinical trial recruitment.
And I'm telling you, it is the only way. And I'm going to say one more thing. It's not on the internet yet, but there's an organization called I Spy, not the breast cancer, but this is the innovation of the Society of Pediatric, International Society of Pediatric Innovators. It's not even on Wikipedia yet, but it's 50 of children's hospitals that have all collaborated now to look for innovative mechanisms. So you will see this coming. We have to knock down the walls. We have to work together.
And And I
We
think
have
you're
one,
seeing that
one last
some, and
question
There's
before we leave. We're running out of
different
time.
working groups that are going on now at FDA that talk about patient engagement. I think so. We have to look, at more centralized sources, like you're saying, to bring some of that data together in one source. Yeah.
As many of us, advocates, we wear a lot of hats. So sometimes we'll have, a page for our child, a page for ourselves, a page for our fundraising, organization or event. How do you suggest with either Twitter or Facebook or joining, trying to keep, rather than posting on 5 different pages that I have, what's the best suggestion to keep everything together?
I mean, I would think it would be hard to have, for a Twitter account at least, it'd be pretty hard to have a Twitter handle only for fundraising. I would think, at least for Twitter, it would make more sense to have one and then share a little bit about your child if you're comfortable doing that. Again, to make your plea personal and to give it a face, right? We're not patients collectively, we're individuals with a disease or caregivers to someone with a rare disease or a sibling or whatever the relationship was. Because again, you need kind of people invested in your journey before, likely before they're going to give you money. I didn't donate to Saving Case until I knew Melissa and started to see pictures like the one of her son with angel wings, that she pulled me into her story. And I think it'd be hard to do that, especially if you have one Twitter handle. I don't follow fundraising sites because I don't want to every day see 3 tweets asking me for money. I want to know your whole story.
Yeah.
Well, that's the thing. It has to, I think I admin 5 Facebook pages. And you want to be narrow enough, but not too narrow, if that makes any sense. So I have one for our foundation. And then when we launched this campaign, Project Alive, people said, well, it needs its own Facebook page. I'm like, no, it doesn't. Because it's a campaign of our foundation, Saving Case and Friends. And we had to address that with every social media channel. So our foundation did not have an Instagram channel. And because the campaign was so visually based, we then created an Instagram specifically for that campaign. So you need to look at each channel and see what type of information you want to put out there and how can it gain followers that has information that they want and they need and they'll gather without being too narrow or too broad.
And keeping in mind how much time you have to spend on it. I do understand Melissa's point about reserving a name so someone else doesn't take your name and start doing stuff that maybe you don't like and you don't want to be confused, but generally don't create pages just for the sake of having one if you don't have time to put into thoughtful content on a somewhat regular basis.
Give a round of applause to our panelists. Thank you very much.
And we hope to find all of you on Twitter. Follow us on Twitter, tweet us, and we will follow you back and send you slide decks if you request.
We have 5 minutes until our next session. Please check your Summit books to see where those sessions are. I think they're rearranging some of the rooms, so make sure you go to the right room.
And if you haven't done your Cures Now photo, my colleague Max has the photo frame, and we can help you take a picture and tweet it to your legislators.